Health is back on the front burner.
Life begins with a single breath, a cry, raw, real, and full of promise. Across Nigeria, that first cry is more than a sound. It's a signal, a call for life, a plea for protection, dignity, and a chance to thrive. Once in many parts of the nation, that cry went unanswered. The silent wails of mothers echoed through corridors of despair. Childbirth was too often a gamble. For decades, Nigeria carried the weight of one of the world's highest maternal mortality rates. Infant mortality among the highest globally. Half of a nation's pregnant women at a time were without access to skilled care. Health centers bare, overstretched, and forgotten. 1 in 13 Nigerian women faced death in childbirth. Care was too far, too sparse, or too late. And yet, sometimes all it takes is one shot in the arm. To jolt a system back to life, to restore trust, and to heal a nation. Today the winds are shifting, bringing in with them a soothing breeze of renewed hope. Today, the once lost cry is now being answered with resolve, coordination, and compassion. From the bustling maternity wards to quiet labs battling outbreaks, a silent revolution is rewriting Nigeria's health story.
By increasing investment in health, Nigeria will be accelerating its human capital accumulation and development, likely to enhance our productivity for current and future generations. Health is back on the front burner.
In just 2 years, what began as a single intervention is now a sweeping transformation. This is that story. It's more than policy. It's a movement with key drivers ensuring a strong and positive momentum. The National Primary Healthcare Development Agency, NCDC, NACA, and NHIA are the hands of the administration laying a new foundation. And at the helm providing vision and direction is Professor Muhammad Ali Pate, Coordinating Minister of Health.
The goal of the Health Sector Renewal Investment Initiative is to save lives, reduce physical and financial pain, produce health, and to do it for all Nigerians, to ensure the poorest and most vulnerable in our society, our children, our women, our elderly, get the care that they need. And as the President unveiled his Health Sector Renewal Investment Initiative, it had 4 pillars. One was to improve the governance in the sector, to bring the federal government, state governments, local governments, private sector, civil society, and development partners to orient us towards serving the Nigerian population, to be more transparent, more accountable, and to use data in the decisions we make. The second pillar is to improve population health outcomes by expanding primary health care and to ensure that the Basic Healthcare Provision Fund reaches the nooks and crannies. All the states of the Federation now receive funds from the Basic Healthcare Provision Fund on a quarterly basis to revamp and to ensure that Nigerians get services. We're expanding the Vulnerable Health Groups Fund as part of the National Health Insurance Authority's efforts. More than 700,000 poor and vulnerable population have been added to that, and more than 2.4 million Nigerians have been enrolled in health insurance, additional to what this administration found. So at a rate that if we had been doing it at this rate, by now more than 40 million Nigerians would have been covered. But that is the direction that we are traveling on. Expanding access to maternal care, the MAMI initiative to crash maternal mortality. The third pillar is to unlock the healthcare value chain. The President wanted health to be a contributor to Nigeria's GDP. There is an economic value, there is a job creation value in that. And PVAC has been doing an amazing job in terms of unlocking the healthcare value chain.
For years, Nigeria's biggest health challenge wasn't eliminating diseases, it was dysfunction, duplication, and fragmentation among the stakeholders. Too many programs, not enough synergy, overlapping projects, and no alignment. The sector needed a compass to remap its service delivery. The compass: one conversation, a strategy born from necessity, guided by 7 pillars: coordination, ownership, measurement, partnership, alignment, sustainability, scale, and above all, one conversation.
We have created a system that is not just vertical, a system that is longitudinal, that is able to integrate with what the state is doing, what the local government is doing, and that is why we have this sector-wide approach, which everybody has subscribed to. The state has subscribed to it, the private sector has subscribed to it. We have a mechanism to support them in developing annual operational plans so that everybody understands what everybody is doing, and we're working as one team to deliver health to Nigerians.
We're very fortunate to have a president who doesn't just prioritize health in his speech and in fact in the compact only, but he also backed it up with money. There were specific resources that was put in the health sector to really work on this. What that really means is everybody working together along these priorities, one set of priorities that the president has given us. We have one plan that is guiding us. We have one budget. So it doesn't mean it's just one pool of money, but everybody brings their resources to align with what government is doing to be able to achieve this set of priorities.
And so all what we do is we key into that vision, and each of us brings our own expertise to support that vision. NHI's one has been one, increasing the coverage of Nigerians with health insurance, working with all the other stakeholders. 2, making sure that when it comes to who is covered, we also think about the vulnerable. So an equity mindset has been brought to it.
For the first time, Nigeria's health ecosystem is singing from same hymn sheet. Federal, state, local, development partners, everyone aligned. One dashboard, one mission. For too long, Nigeria's health indicators were haunting. Barely 40% of pregnant women accessed skilled care in 2000 and just 50% a decade later. Those poor records seem to be fading. Under the renewed hope agenda, maternal and child health is now a national priority. No woman, no child is to be left behind.
Free treatment of fistulas from obstetric complications, the vesico-vaginal fistulas. More than 2,000 women all over Nigeria have been repaired free. Their lives have been given back to them. Now, vaccination. At least 60 million doses of vaccines have been delivered, different types of vaccines. Nigeria has one of the highest vaccination coverage among the cohort that we targeted for human papillomavirus vaccine to prevent cervical cancer, improving screening, as well as expanding the infrastructure at the tertiary level so that the quality of care that is being provided for Nigerians is enhanced. Cancer centers. We set out to expand the cancer center imprint. And believe you me, 3 of the cancer centers out of the 6 will be commissioned in May or June 2025. That is a year and a half after the president approved for it. It's unprecedented.
In partnership with NPHCDA, a network of modern, functional primary healthcare centers is reaching deeper than ever before. PHCs have been revitalized with solar power, digital records, and skilled personnel. What was once impossible is now visible. In 2 years under President Tinubu, maternal deaths now down by 25%, infant mortality down by 15%, antenatal visits up to 80%. In the Northeast, conflict made care unreachable, but now a remarkable turnaround is quietly taking root. With targeted investments and dedicated health workers, antenatal attendance has soared over 60% in just 2 years.
That turnout of women is good, and they are responding to the objective of the medical outreach. We are grateful to the governor of Borno State because medical care and services is brought to us, and we get all we need even after midnight. We used to travel long distance just to get to the hospital, but now that's history, thanks to the governor of Borno State.
In Bayelsa, the terrain is tough, but the spirit is tougher. Once challenged by difficult terrain and low health-seeking behavior, Bayelsa's maternal and infant health indicators have improved significantly through localized health interventions, both clinic outreaches and revamped primary health care centers. These interventions have birthed a positive story.
There's just great awareness among the mothers. Before now, some mothers, when we go out to immunize, they will run inside their room, lock their children inside the house. But those things, we don't longer see them. They come on their own to the facility to obtain this immunization. We thank God for federal government for giving us the opportunity to, even the less privileged.
In several other states, like Bayelsa inclusive, those provisions have been made for renovation of healthcare facilities. So we've also had our fair share of the healthcare facilities that have been renovated in Bayelsa.
The number of pregnancies that are supervised and are delivered with a trained personnel has increased. There is this executive policy approved by the State Executive Council that every child that is being admitted in private, public, nursery and primary school must show an evidence of immunization certificate. It is a structured collaboration, multi-sectoral collaboration between Ministry of Health, Ministry of Education to reduce our zero-dose cases.
Meanwhile, in the Federal Capital Territory where access meets innovation, compliance exceeds 85%, a proof that trust in our primary health care centers is growing. Through strategic collaborations, health facility upgrades, and a renewed public trust in primary health care centers, the FCT now leads with over 85% antenatal care compliance, a figure that reflects both access and awareness.
With the renewed health agenda has led us to prioritize the essential medicines. So prioritization has been made for the services of maternal and child health, as well as services of non-communicable diseases, as well as communicable diseases. This has been easy and has been done across the 6 areas. Again, another innovation that functions very well during this renewed hope agenda is the issue of health insurance scheme.
From Borno to Bayelsa to Abuja, the message is clear. Nigeria is turning the page. PHCs are no longer last resorts. They are first responders. It is an infectious positivity permeating the health spectrum.
Budget of the NPHCDA more than doubled between 2023 and 2024. So that allowed us to intervene. And as part of our PHC revitalization efforts, for example, we have now directly, revitalized about 340 or so PHCs across the country. Many of that have been completed. Many of that are still in process. And also working with the states and partners in all, another 500. So we have about 862 primary health centers that between when we started and now, they have moved from being substandard to what we call level 2. In terms of the ones that are being worked on as well, both by us directly, by some of our partners, but also by the states and local governments, is another 2,419 or so, almost 2,000, over 2,400. So when you put all of that together, we're saying well over 3,000 PHCs by the end of 2025 will have been added that are functional to what we had when we came in. That's not trivial. Again, I don't think that's happened in the history of the country in the space of 1 year. And that's the leadership of Mr. President and his commitment and resources, but also the vision of the minister who's leading all of us to do this.
Under one conversation, maternal health is no longer a scattershot effort. For instance, through renewed hope initiative of the First Lady of Nigeria, Senator Oluremi Tinubu, government is linking skills and empowerment to maternal health by providing equipment to midwives and tools to enable women meet their daily needs. Today, over 80% of women now have access to routine antenatal care, and maternal deaths have dropped by 25%. It is a monumental step, one that promises every Nigerian mother and their children the gift of care and protection during the most vulnerable period of their life.
And that's an important signal of support at the highest levels. Investing in issues like tuberculosis, Resource for Renewable Initiative, contributing 2 billion naira, unprecedented, so that we can screen and treat people who have tuberculosis for us. She's the global champion in the fight against TB. So we've seen Her Excellency coming in to support the administration in ways that will advance the health outcomes improvement. As I said, we want to save lives, we want to reduce physical and financial pain, produce health, and to do it for all Nigerians. So the First Lady has wrapped around that agenda and supported with the Renewed Hope Initiative in a very beautiful way, and we really appreciate that.
The world has changed, and so has the threat to public health. From Ebola to COVID-19, Nigeria has stood at the front line of deadly outbreaks. These weren't just health crises, they were national emergencies. But Nigeria is not standing still. The Nigeria Center for Disease Control, NCDC, is now better equipped, more responsive, and more proactive than ever before. Strengthened by the experience of the past, NCDC has become the nerve center of Nigeria's disease intelligence. Whatever the threat, the strategy is clear. Act fast, act smart, and never again be caught off the guard.
When I came in, the weakest link in NCDC was disease prevention. We are tracking disease prevention in a way that it is culturally sensitive. Everybody is involved. So when we create messages have to be domesticated to those local government areas. So it takes a while. We have to send to them to domesticate, to reflect their situation there. For surveillance, tracking, we are doing better than we met using technology. We're using now cutting-edge methodologies to address this. If you recollect again, we're going to genomics surveillance, using DNA technology issues in more so that you get more information and it's quicker. And to do that again, we're going to environmental surveillance. Luckily, there were a set of laboratories established where we're going now, we're expanding on that, building on that again, using technology. There's National Response Laboratory in Abuja. There is a CPHL in Lagos. Those are two response labs nationally. Now we have zonal labs. But again, when Ashaju came in, we met zonal labs in different stages of complaint, very few of them. Unfortunately, this factory was stopped because of ICPC, ECFS probe. We just recently got the files back and now are planning to complete many of them.
At the heart of Nigeria's health battles lies a long-standing fight against HIV. Today, thanks to National Agency for the Control of AIDS, NACA, the tide is turning. Providing support, young people accessing treatment, free testing campaigns in urban and rural centers. Through partnerships, innovation and community-driven action, HIV treatment coverage has expanded. Access to antiretroviral therapy, ART, has increased dramatically. 1.9 million Nigerians now on sustained treatment. HIV is no longer a death sentence. It is a managed condition because access has met action.
The establishment of the SWAP, which is the sector-wide approach for strengthening collaboration and also integration of services, in which it's helping, and we can see the evidence of government commitment. There's also the establishment of the PMCC Acceleration Prevention Team, which helps in the area of mother-to-child transmission. And also the aspect of development of the sustainability roadmap.
There has been a reduction in the cases of new infections in HIV/AIDS in Nigeria in the last 2 years, and that can be related to the fact that there is more case finding. We are doing much more testing, in the community and even at the health facilities to find those that are positive with HIV, and for those that are positive, we are putting them on treatment and also ensuring that they stay on treatment. The federal government of Nigeria, with collaborations of partners and donors, has been procuring the antiretroviral drugs, and these are available in our medical stores all over Nigeria. These drugs are sourced centrally by the federal government and distributed to the states, different 36 plus 1 states. And this is ongoing, and I want to assure everybody living with HIV to say that the drugs are available despite the recent global funding challenges that we have.
With a push for self-testing kits, youth-targeted programs and integration of HIV services into everyday healthcare, NACA is reshaping lives and restoring dignity.
The government has created the enabling environment in terms of anti-stigma laws and anti-discriminatory laws and workplace policies to ensure that nobody living with HIV/AIDS, HIV is discriminated against. These laws are already being domesticated in many states of the Federation, and we are working, with the subnationals to ensure this, to ensure that we have an AIDS-free generation and people, can actually live in a conducive environment. Also, I must commend the Office of the First Lady of the Federation, Her Excellency Senator Oluremi Tinubu, because she's also championing the triple elimination of HIV, hepatitis, and syphilis. And this campaign is ongoing in the 6th geopolitical zone. And we are also working very closely with that office to ensure that, we take these messages to the grassroots. I think one of the greatest impacts is the political will. As we speak, the government ring-fenced, and included $200 million US dollars in 2025 budgetary allocation to ensure that there's no disruption in services. So that shows a strong community political will, and it kind of gave assurance to people living with HIV that they are not alone.
From despair to renewed hope, the mission is bold, the steps deliberate, the results transformative. But health isn't just about facilities or medicine. It is also about affordability, because care that can't be paid for is care that can't be assessed. What good is care if people cannot afford it? For too long, out-of-pocket expenses pushed families into poverty, forcing choices between food and medicine. The National Health Insurance Authority, NHIA, is a financial backbone for Nigeria's health equity. Today, NHIA is changing that story.
About 600,000 Nigerians were added to it, bringing it to about 2.5 million Nigerians, about 400 that are covered by it. Now, with the strategy of the government, any woman that is in labor and develops any complication and can't afford it, we have instructed that they be treated, and NHIA gets the claim and the bill, and we pay for it. And as of today, from November when this was launched today, over almost 4,000 women have been treated free for complications, including cesarean section.
In 2 years, Renew Hope has delivered not more than 25% increase in the level of Nigerians that are insured, that have healthcare insurance, at least 25% increase. In less than 22 years, Renew Hope has provided additional 12 federal tertiary health institutions.
And the defragmentation of the health sector is already happening, ensuring that we have one conversation owned by government that is around one budget. We have one annual operational plan by all the 36 states, which is focused on our priorities that our partners are supporting.
From the first cry to a healed system, there is a well-designed compass now, a true guiding vision for the nation's healthcare delivery system. So, yes, it begins with a cry, but today it ends with something stronger, a promise. From vision to vaccines, from policy to people, from silos to one conversation. This is not just a health story. It is a call to action, a commitment etched not in policy alone, but in every heartbeat that continues because someone cared enough to change the system.